Epidemiological data reveals a significant mental health challenge in South Korea, where the national depression rate currently approaches 37%. Traditional clinical infrastructure is structurally strained by this volume of care, creating a measurable gap between patient needs and hospital availability. To address this capacity gap, healthcare networks are now integrating ancient Buddhist monastic sites into national psychiatric protocols. These are practice-based interventions. Environmental psychology research indicates treating patients outside medical facilities produces measurable improvements in psychological stability. The speed of contemporary cognitive burnout frequently outpaces the expansion of clinical wards. This necessitates decentralized environments that can absorb the overflow of the modern patient population. This shift toward monastic environments is not merely a cultural trend. It is a structural recalibration designed to alleviate the sustained pressure on traditional clinical capacity. Conventional clinical settings, characterized by high-intensity lighting and rigid schedules, are often suboptimal for long-term psychological rehabilitation. Research suggests specialized, natural environments are more effective at attenuating cortisol levels to facilitate cognitive restoration. Medical frameworks have begun to formally incorporate monastic immersion, creating a bridge between clinical science and historical regimens. The Temple Stay program is a primary structural example of this collaboration between clinical and monastic institutions. In this model, mountain monasteries operate as calibrated psychological stabilization units, shifting the focus from leisure toward rigorous treatment protocols. While passive exposure to nature reduces stress markers, data suggests that active physical rituals are essential for comprehensive healing. Unlike standard hospitality models, which rely on passive consumption, this framework requires active cognitive realignment through disciplined practice. Environmental control is a requisite component of this care. Facilities enforce the mandatory removal of mobile devices to specifically mitigate digital fatigue. Geographical and digital isolation facilitates a specific psychological state, defined in clinical terms as the state of being away. The efficacy of this therapeutic framework depends on the architectural protection of participants from external digital stimuli and environmental noise. This chart shows the global wellness tourism market expanding from $1.02 trillion to $2.6 trillion by 2032. Much of this growth is driven by the shift from traditional clinics toward these integrated, practice-based recovery models. This financial scaling allows historical monastic sites to receive the funding required to act as primary pillars for national mental health support. This expansion represents a direct market response to the limitations of existing healthcare infrastructure. The synthesis of historical rituals and modern psychology provides a resilient framework for future healthcare governance. Protecting the integrity of these architectural environments from modern encroachment remains a critical long-term strategy. Practice-based environments serve as a scalable layer of support that operates outside the physical constraints of traditional psychiatric hospitals. Integrating these historical sites into clinical protocols establishes a durable response to the complexities of modern psychological decline.